Welcome back. Same host, new deep dive in episode 2 of Pedagogy Viva Prep for MD exams of Community Medicine. If you're new here, subscribe, like, and post your requested topics. We're building India's only snappy audio guide for community medicine, Pedagogy Viva Prep. Today, I'm with Dr. Joshi. Let's jump in.
Let's start broad. Teaching approaches. Teaching approaches can be teacher-centered like lectures, student-centered like inquiry and problem-based learning, blended models and technology-enhanced strategies like flipped classrooms.
Quick contrast, direct versus indirect teaching.
Direct is explicit, teacher-led instruction. Indirect is student-centered, using discovery and inquiry to cultivate critical thinking.
Dr. Joshi, give us small group methods, at least 10, with one strength and one limitation.
Buzz groups with fast engagement but superficial depth. Case studies where real-world thinking happens but are time-intensive. Role play brings in empathy but can also bring in discomfort for some. Jigsaw brings in interdependence but participation can be uneven. Think, pair, share is inclusive but can drift off topic. Fishbowl is where observation learning takes place but can be with a passive outer ring. Seminars can let one deep dive but may amplify only dominant voices. Panel discussions bring in diverse angles but prep load is high. Problem-based learning stimulates critical thinking but are resource-heavy. Cooperative learning involved a lot of teamwork, but that can sometimes invite a group conflict.
And the classic techniques? Brainstorming, fishbowl, jigsaw, think, pair, share.
Brainstorming encourages free-flow ideas without judgment. Fishbowl runs an inner discussion circle while others observe, then rotate. Jigsaw creates topic experts who teach peers. Think, pair, share moves from individual reflection to paired discussion to whole class sharing.
Large group methods?
They are lectures, demonstrations, guest talks, debates, interactive polls, and multimedia. Efficient for coverage, but risk passivity, so one has to make them interactive.
Pause and recall. Name 3 ways to activate a large group session.
A practical opener is set induction, a crisp story, image, or question that hooks attention and links prior learning to the new topic.
Attention tends to dip after 10 to 20 minutes, right?
Yes, so vary your stimulus. Change voice, movement, media, invite a quick pair activity or poll.
I love the lighthouse effect, a steady visual sweep across the room, something that we discussed in the last session.
Yes, it sustains engagement and deters side talk, simple and powerful.
Dr. Joshi, even with the lighthouse scan, real classes have distractors, side chats, phones, wandering attention. What do you actually do? Moment to moment.
4 quick moves. Proximity control, quietly move closer, most side talk stops without calling anyone out. Redirect with questions. I need 2 ideas from this side, go. Incorporate movement, quick stand and pair or a walk to the board for a minute. Reset expectations, briefly restate norms, one conversation at a time and resume.
And if device is the culprit?
Convert it into a task or look up the district RMNCHA indicator and report in 1 minute. Or park phones during short bursts of teaching. Always keep it professional, not punitive.
Tools of the trade. PowerPoint done right.
Okay, in PowerPoint, keep slides clean, about 5 lines per slide, 5 words per line. Readable sans serif fonts like Arial at 24 point or more. Good contrast, consistent layout, and for a 20-minute talk, around 10 slides, the 10-20-30 spirit. Also have a backup. If power fails, switch to handouts or board work without losing the thread.
And PowerPoint versus chalk and talk?
Chalk and talk allows real-time pacing and quick sketches. Advantages of chalk and talk include low cost and flexibility for explanations. Disadvantages are limited engagement and reliance on teacher delivery, potentially leading to passive learning. PowerPoint brings visuals and media. Use both judiciously, avoid over-dependence on slides.
Rules of chalk and talk?
Write clearly and legibly, organize content logically, face the class while speaking, use diagrams sparingly, and incorporate questions to maintain interaction.
Which are the alternatives to a projector?
Whiteboards, charts, models, audio clips, flip charts, and hands-on manipulatives.
Dr. Joshi, faculty development staple, micro-teaching. Define it and tell us why it works.
Micro-teaching is deliberate practice of a single teaching skill, say asking higher-order questions, in a very short lesson to a small peer group with focused feedback and reteaching. The power is in the tight loop. Plan, teach 5 to 10 minutes, feedback, reteach.
And how is that different from mini teaching?
Mini teaching runs longer, about 15 to 20 minutes, and integrates multiple skills in a simulated class. Micro is for isolated skill drills. Mini is for putting several skills together in a near-real session.
If I had one afternoon,
Okay, do 2 micro cycles in the morning on questioning and board work, a mini teaching in the afternoon to integrate both, record, review, and set one improvement target for your next real class.
case vignette, you're teaching outbreak steps to a large mixed ability class. What would you do?
Start with a striking photo to set induction, lecture the skeleton or outline, then a buzz group to list steps, a jigsaw for sub-steps, and a poll to consolidate, all aligned with your apply objective. Use the Lighthouse scan and stimulus variation to keep energy up.
Final quickies, how to involve everyone and how to revive a silent room.
Use random calling, group responses, think, pair, share, or response cards so all voices count. If the room is quiet, rephrase, give a worked example, wait, or use an anonymous poll to lower the stakes.
Dr. Joshi, when we facilitate small groups, we often double as mentors. What should an effective mentor actually do?
A mentor guides and supports learners, offers timely feedback, models professional behavior, facilitates skill development, and helps with career planning and personal growth. It is less about giving answers and more about scaffolding thinking.
Give me a miniature playbook for a semester.
Okay, start with the goal-setting meeting, agree on 2 to 3 concrete outcomes, schedule brief check-ins, and use feed-forward, here is what to try next time. Spotlight ethics and communication in real cases, and close with a reflective review that converts experiences into lessons.
If this episode made your teaching feel more click than clunk, subscribe, like, and share it with your cohort. Comment your trickiest Pedagogy Viva prompt. We may feature it next time.